We are very excited in CLL since 10 years, I have to say, because we have been very lucky to have a number of drugs very effective, and in particular who have been able to steer the treatment away from chemoimmunotherapy. So now we have mainly biological treatments, BTK inhibitors in principle, and BCL2 inhibitors. These are the two major classes that have established as nowadays standard of care for patients in both frontline and also in the relapsed refractory setting. So we had a lot of excitement. We have been able to prolong the survival of our patient, even overall survival, compared to, so that the patient with CLL nowadays can expect a life expectancy very similar to those of individuals, unaffected individuals, general population. So this is a great success. So what is the next step? The next step would be to cure this patient. Because we want to stop the treatment, so we want to have a patient without disease and remaining without disease. This is something that does not happen at the moment with the current treatment. So what is most exciting at this moment is to try to combine these different drugs, so BTK inhibitors, BCL2 inhibitors, maybe even the anti-CD20, and in particular having a time-limited treatment. Probably the fixed duration treatment that has become also standard of care is not so meaningful, because we are applying the same quantity for the same time, same quantity of treatment for all patients, and this is not correct, because all CLLs are somehow different to each other. So we have really to define a better time-limited strategy of treatment of our patient, and that would probably imply the use of minimal residual disease detection, MRD detection, and that's probably where I'm most excited in the future. So really to bring the MRD analysis into the clinical activity, into the clinical routine, so that we can take decision based on that to intensify the treatment, to shorten the treatment, to add or prolong another treatment. But that remains still to be studied, so that's where I expect most of the advancement in the future. So studies, clinical trials designed for being MRD driven.